one comment that the problem is not the Affordable Care Act, and the problem is not the insurance companies. The problem is we want a solution for health care for everybody, on one way or the other. We're not going to reach it if we're attacking one side and defending another. The only solution will be a resolution solution that Congressman Tenney and her colleagues get together and realize there is a problem. Let's address the problem and not attack each other in Congress. It goes with health care, it goes with all other issues in politics today. We have to resolve to recognize the problem. And the problem is not one side or the other. The problem is we're not looking for the solution. We're only attacking.
Thank you very much. Any other thoughts? We have a lady in the back.
Hi, my name is Angela. I have always worked in the field with people with disabilities. It's always been my focus. Yeah, okay.
I would say maybe step forward a bit.
Okay, this is good? Yeah. Okay. I've always, my primary focus my entire life has been with people with disabilities. Getting services through Medicaid, home and community-based labor services, has allowed many of my people to live independently. 2 years ago, I gave birth to a child who has medical conditions, and I never realized what it was like to be a parent of a child with a special need. And he, in the first 2 weeks, we put him on Child Health Plus, but Child Health Plus doesn't take effect until the first month, or the first day of the next month. He was put in the hospital after the first week of life, and we racked over $30,000 in medical bills. Because of his disability, his medical need, we were able to reverse it and go back to the day that he was born so that we didn't have such excessive medical bills. And this, if ACA is gone, that's a great possibility that a lot of families will be focusing on more medical bills for their infants. So I just think it's a really, really important factor to realize.
What do I do? Am I radiating electricity?
There's one area.
All right.
You hold it close to your mouth.
Close to my mouth. Okay. I really was telling myself, no, sit down, shut up. Don't. But you people are too honest. We have heard terrible things, and that was the worst. A child in the first month of life, $30,000 to her parents. I'm going to tell you, the gentleman in the front said, we have to have a solution. Well, you have to deal with the problem. You know what the problem is? It's called capitalism. That's what the problem is. I am not a wild-eyed radical. I don't love Che Guevara. Let's get me right off the bat. But there was an old guy out there with white hair. You know, remember him, Bernie? He got all the kids going. And when they didn't get Bernie, they didn't vote. They stayed home. And a lot of the black people stayed home. And that sort of thing, you know. We have to address the true problem. Capitalism is about making money, nothing else. Don't shoot them. That's all they know, is making money. They have no morals, they have no philosophy, they have no standards. They're just making money. That's what they're supposed to. They know that. That's Donald Trump. He's an idiot, but I mean, you know, he's making money. That's all he knows, the art of the deal. So don't shoot them, but get rid of them. They're going to go on. People who want to do that sort of thing are going to do it no matter what. They'll do it in communism. Look, they've practically taken over Russia. So, we have to deal with the root cause. and you can start with health care. Shut up about the money. Everybody needs health care. We're human beings. I'll sit down. I will sit down, but I got hold of a mic and I'm dangerous. You know, what's his face? The mic. Anyway, he went to Canada. He made a movie about guns, and he went to Canada. He asked a Canadian girl. She had things in her nose and things in her ears and a tattoo, and you know, oh, this is just a weird kid. And he asked the kid, why should your country take care of everybody in the country regarding medical care? And the kid said, because we're human. You can't beat that answer.
When I was a child, a long time ago, in the 50s, we had a congressman. His name was Edwin Arthur Hall. How many remember that name? The problem is nobody remembers, so I have to tell you a story about that time. He was not a good congressman, the details of which I don't remember because I was less than 10, but I know the family conversations. And what liberals did in the 50s is they all changed party. They registered Republican, they beat him in the primary, and they stayed loyal to the Republican Party. Sometimes, if your heart is in the right place, don't matter what party you're in, because the way to make a difference is to get rid of bad guys. Now, that goes against a lot of people's grain. They're not going to change. But you can re-register after that election any way you want. I give you something to think about.
Okay. Any comments in the front row?
Here you go. Here you go.
This is again to Claudia Tenney, and if you look at the district that you represent, what do you represent? It's an aging group of people, it's not a wealthy district, and what we need is health care. And if the ACA isn't there, it's going to impoverish the community even further. There'll be less money for development, there'll be less money to anybody to go take a chance on anything good going on in this economy. And the other thing is that if it goes to the states, which is the other option that they're talking about, and having every state do it, it's going to put New York State in a terrible position. We also have an aging state population to a large degree outside the city. This is not going to help your district. That's all I'm going to say.
Hi, I'm a member of Citizen Action, but I've also been part of this community for 43 years. My name is Fran Ferentinos. I'm here to share my story of how the ACA has saved my family financially by helping us avoid medical bankruptcy, and may also be representative of many other families in our community, as it's definitely, as we've heard here tonight. My husband has worked for local businesses since the 1970s and always needed to purchase private health insurance at full cost from his employers, even when he became self-employed 24 years ago and up until 2014. Due to my pre-existing conditions of Crohn's disease, spinal stenosis, and degenerative disc disease, which requires treatment with immunosuppressants, corticosteroids, and annual colonoscopies, our family's health insurance premiums were always very high and always ever increasing, which was perfectly legal before the passing of the ACA, as we've heard before. These pre-existing conditions necessitated multiple spinal and hip surgeries in my 20s and 30s, including a spinal fusion and a damaging procedure called chemonucleolysis, causing spinal epidural hemorrhaging and scarring. As a result, I ended up using a wheelchair for ongoing pain management when we couldn't afford the high out-of-pocket cost for home health aides. Consequently, my ability to work outside the home was also greatly affected. We also needed this costly health care coverage for our daughter, who suffered a concussion from a serious bicycle accident and has severe asthma, in order to pay for daily nebulizer treatment and rescue inhalers, which without insurance would have cost over $2,100 per month. In total, the prescription cost alone for our entire family would have exceeded $5,000 per month. Our daughter has greatly benefited from the ACA by being able to stay on her father's plan until her 26th birthday while still attending college, as we've heard from many of you tonight. Many young adults across the state and country have also benefited. By 2013, our monthly premiums cost over $1,600, which was often over 50% of our monthly income, as my husband was already reducing his workload for both my care and that of his elderly parents. As we were heading closer and closer to medical bankruptcy due to our ever-increasing premiums, co-pays, and deductibles, the ACA was passed and monthly premiums for our family were reduced to $400, a monthly savings of over $1,200. On the New York State Marketplace's Silver Plan, my family receives tax subsidies to help with both our premiums and out-of-pocket costs. Yes, we personally have seen monthly premium increases in the past 2.5 years by the insurance companies that cover the southern tier, but at least these are now capped, as we've also heard here tonight, and haven't been rising by 10% a year, as when there were no caps on rising premiums for the sick. And under the ACA, insurance can't deny coverage or increase rates just because you have a pre-existing condition. My family and I did not lose our home in order to continue paying for our health care, but many families did. Although I am now on Medicare, this is a program that still benefits members of my family. If the ACA is cut, those of us on Medicare will also be affected. Seniors and disabled individuals will lose thousands of dollars per year on increases and/or additions in cost. These cuts will hurt our local economy and community by affecting all ACA, Medicare, and Medicaid recipients, hospitals, physicians, nursing homes, and more. 6 in 10 uninsured Americans can get covered for $100 or less a month, and over 20,000 individuals in Broome County depend on the ACA. So in conclusion, I have to say this: Social Security began as one of FDR's New Deal programs and evolved over the decades to become what it is today. I think that we can do the same with the ACA. So let's keep what we already have and improve, amend, or expand it with compassionate, humane, bipartisan support from all of our legislators.
Claudia, and then don't leave, we have a bunch of things for you to do, and we're gonna take more pictures and send louder messages to Claudia. Okay, they haven't come yet.
Yeah. Claudia, and this is to keep it short but honest, if we don't have health insurance, people cannot get their flu shots. In September, you will see nationwide, county-wise, nationwide, people dying off from influenza if they can't get the flu shot in time. So that's something to consider too.
That's right. I comment that we're going to move into our action, and then we want to take some good pictures with the sign.
Claudia, I assume that you have a staff that is here in New York State, and I'm wondering why you didn't send a representative to this meeting to represent you. I don't see your staff representative, but I don't think that's asking much of their constituents to have somebody here to really listen to what people have to say.
If she can't be here, somebody representative.
I'm going to hold on. Just keep it short. If anyone else who hasn't spoken wants to speak, Sorry, we have, I'll get back to you.
Thank you. My name is Maria, and I'm just wondering for Representative Tenney, if it is the case that this is such a fearsome place to be, I don't find it all that frightening. I want to just share something that I found tremendously frightening this November after the election. Just seeing the result and seeing repeal Obamacare taken as far as it has been, that looms on my horizon as a very serious possibility that I personally lose my Medicaid, which I have because Medicaid was expanded under the ACA. And I have bipolar depression. It hit me about 3 years ago. I was able to get treatment because of Obamacare, because I was covered under the up to 26 provision, and then with the expanded Medicaid. It takes 4 daily medications and twice a month therapy sessions to remain this functional, and I remember what it was like before being on treatment, and that is a tremendously frightening thing to potentially return to. And it's always the case that removing yourself from medication is sometimes even worse than having never started it before. Dropping medications all of a sudden can be traumatic. So seeing this possibility on the horizon of no longer having health insurance, of having to stop my treatment, that just sent my mind into just a spiral. It could truly end up being a downward spiral into depths that I have never seen before. It could end with an attempt on my life. I have no idea at this point. It's a scary thing to have to think about, and it's scary to feel yourself becoming just a pawn in a political game that's going on. These are our lives that are in danger, so please don't take our fear lightly.